Yeah, most of the time when somebody comes to us early in the stage of a valve disease, we manage to treat them with medications. Medications will be able to control their symptoms to a significant extent. But a point will come in the progression of the disease when the disease has become very severe and medications are no longer sufficient to treat the disease. The signs to watch out for in an individual who suffers from valve disease is worsening breathlessness, worsening chest pain, and inability to carry out his normal activities of daily living, which he was able to do earlier. So, if any change in the clinical functional status, we call it a functional status of the individual, that is, the individual is not able to carry out his normal activities of daily living, which he was a few days back or a few weeks back was able to carry out without much difficulty. So when there is a worsening clinical condition or functional capacity of the individual, that is the time when the individual should seek a medical review to reassess his heart condition and decide if something more than medicines is required.